What is fatty liver disease? Fatty liver disease is formally called metabolic dysfunction-associated steatotic liver disease, which is a long phrase, but basically means the fat is being preferentially stored inside of the liver and causing a problem. So when fat is stored inside of the liver cells, it tends to cause some irritation to the liver or inflammation. And that's typically how we first identify these patients, because we'll see elevations in the liver enzymes that might be checked on routine blood tests. And the reason this matters is because when the inflammation is there for a long time, it's chronically irritating the liver, and the liver reacts by causing scar tissue to form. And that's what we call fibrosis. And over time, if this continued stimulus of irritation is there and the body keeps reacting by causing more and more scarring to form, eventually so much scar tissue forms and replaces that normal healthy liver tissue that you can get what's called cirrhosis. So fatty liver disease is really important to know about for a couple of reasons. Number one, it's really common. It actually affects between 26 and 32% of all adults in the United States. And it happens more commonly in patients living with obesity and also in patients of certain ethnicities. So for example, Hispanic patients are more affected than patients of other ethnic groups. Second, and probably most important, it is reversible on many patients when it's caught early. In fact, in the early stages of disease, it only takes about 5% body weight loss to really improve or even resolve the changes that we're seeing in terms of the fat being stored in the liver. And 5% weight loss is doable for a lot of patients, particularly now that we have the help of some of these newer anti-obesity medications. And lastly, it's not something to ignore. Even though most people who are diagnosed with this condition feel fine and have no symptoms, we know that if it's there for a long time and it's allowed to progress, it can lead to serious or life-threatening complications like cirrhosis of the liver, a particular type of liver cancer called hepatocellular carcinoma, and even the need for liver transplant. And in fact, fatty liver disease is now the second most common cause of adults needing a liver transplant in the United States. So the bottom line is, if you've been told that your liver enzymes are high and your doctor suspects fatty liver disease, it's not something to ignore. Make sure you ask lots of questions and leave that visit with a clear understanding of what steps you can take to reduce the chances of your disease progressing. I'm Dr. Tara Altepeter. I'm a board-certified obesity medicine specialist practicing in Silver Spring, Maryland in the DC area. If you're interested in learning more about this or other related topics, you can drop me a follow.